hear out from each and every other person in the room. You only have 2 seconds to, mention your name and what where you're coming from, or what company or what entity or institution that you're actually representing, or where you are coming from, and we will definitely dive into the whole program shortly thereafter. So you should be able to enjoy this already. It's a vibe thing. It's a cool thing. It's a youth thing. It's a Mbarara thing, right? So we're not going to waste any more minutes. We want to pass on the microphone. Say hi to us. Tell us who you are and where you are coming from. You could still end it with a line of what you expect from today's dialogue, but that is definitely a lot for only 10 seconds. So we are interested in your name and where you're coming from, and any other that you can be able to drop will be a plus. A very good afternoon, ladies and gentlemen, once again. Let's roll with our participant number one. Thank you. It is simple. You rise, look into the camera, or you could still look at the audience, tell us your name and where you're coming from. Thank you.
Thank you, sir. My name of my Monique is Lado Godwin, and I'm offering National Certificate of Plumbing, and I'm a student from MCI Community Institute. I'm very grateful to be in this space, so I'm feeling amazing. But since the time is not our friend, let me welcome the second.
Yeah, thank you very much. This is Asimwe Bernard from Barara Community Institute, offering National Certificate in Electrical Installation and Maintenance. Thank you very much.
I'm Ankunda Shivan from Barra Community Institute.
I'm Chogabi.
My name is Adrian from Global High School.
I'm Imagine Chokunzile Global High School.
I'm Search Mile from Barra High School.
Hello everyone, I'm Arihura Rita from Global High School.
Aren Chakwera from Global High School.
I'm Akampura Precious from Global High School.
I'm Igiraneza Christianize from Global High School.
Hello everyone, my name is Mugisha Silva from International Window School.
My name is Mbawazi Ben from International Window School.
My name is Robert Dimanga from International Window School. Hello everyone, my name is Tishme Christian from International Window School.
I'm Moimondo Miguel from International Window School.
I'm Mohammed Saeed Adan. I'm from International Window School.
Good afternoon, ladies and gentlemen. My name is Juma Sulaiman from Window International School.
My name is Mukama Ronald.
I'm Esther, a neighbor to Innovation Village.
Solomon Vincent is the name. Coming from Luero, but now I'm working with Multiplex Limited Construction Company.
Hi everyone, I'm Namga Caroline from International Window School. Thank you.
Good afternoon to you. I'm called Ninga Shan, a student at International Window School.
Hey everyone, I'm Shawada Stella Kaisha from International Window School.
Hi everyone, I'm Akampa Olivia, International Window School.
Here in Mrangira, International Window School.
Hi everyone, Woman Oscar from International Window School.
Hello, good afternoon. I'm Watijuka Arthur, International Window School.
Good afternoon, everyone. I'm Iranez Zagi Caleb from International Window School.
My name is Irumvo Joshua from International Window School.
My name is Gaxel from International Window School.
Hi everyone, by names of Ilanko, that's mine, Justin from International Window School.
Hello everyone, my name is Nabainda Christine from International Window School. Good afternoon, I'm Maureen Katsime from International Window.
Hi everyone, I'm Kakunda Alines from International Window School.
Hello everyone, I'm Kawain Shamim from International Window School.
Hi everyone, I'm Kaveh Christian for International Window School.
Hi everyone, Akunda Rina YMC.
Hi everyone, I'm Anne Patricia, YMCA.
Hi everyone, Aheza Bridget from YMCA.
Hi everyone, I'm Atine Shiba.
I'm called Agaba Jacob, YMCA.
Hi everyone, my name is Ainemba Johnson, youth chairperson from Barara City.
Mwasiba kurungi Kavi John ry'izina ryanje ninzuye kiremyeto yambara site aza nimwe murumu ikintekateka kufuna mu dialogue omu n'ebirowozo byanyu ebikwatagine na youth friendly services omu masomero ganyu na no marwaro gutino mu Mbarasiti.
Good afternoon. I'm Dr. Alex Rutebwa. I work with Mbara City. Kandi nkurira iby'abacyara n'abana akwatiguye mu neminyeto nkimu twabakira.
Good afternoon. Dr. Mugisha Kairuche, Head of Health Services in Barara City.
Good afternoon to you all. I'm called Mutibwa Lydia. I deputize the CHO coming from Barara City. Nice meeting you all.
We are very lucky to have you around. It is something we don't take for granted, definitely. So if you could remember what was communicated in your letters or whatever form of communication that was used, we are definitely a few minutes late. So you will allow us to definitely, quickly, and any other word you can pick from the dictionary, we start right away. Who could be knowing why we are actually here today? Someone confident as to why we are actually here this afternoon. Now we're meant to be sharp. Why do you think we are here?
To learn about your life, our life.
Learn about our life. Okay. So, well, we have someone here. God loves you so much. Say amen. Okay. Why are we here?
We are here to talk about health issues, maybe. That's how I think.
Okay, we are here to talk about health issues. Do we have someone else willing to take that chance?
Actually, we're here to talk about sexual reproductive health issues. Like here in Uganda, we face very many early pregnancies. So these are some of the reasons why we're here.
Okay. You're limiting it to pregnancies? Okay, please.
Thank you once again. I think we are here to share ideas on the ways how we can improve our health in youth and also the adults. That's my point of view.
Okay. So whatever it is that we think, as long as you featured the word health, you are definitely right. If you went to facts, finding out what takes largely the largest portion of an African man or woman, it is going to be related to medication, it's going to be related to health, that you can be able to sell even whatever property that you have had to make sure you actually nurse yourself. But certainly what we all talked about So certainly what we shared could not be all, and that is why at this very moment, I will be able to invite someone to get us started, someone to remind us why we're here, and we can be able to pick it up from there. There is quite a lot that is coming through. I will be able to tell you, but I only want to share with you after this gentleman has actually shared with us a brief of why exactly we are here. Ladies and gentlemen, we are going to do it the London way, and we give it up for Comrade Chris. No, you did it a Rebecca way. We said we do it a London way, okay? So yes, Comrade Chris is from Harm Reduction and Reproductive Health Initiative, and he is here for the opening remarks. And slightly after that, we'll be able to roll into the next part of our program this afternoon. Thank you.
Yeah, thank you, Sankala. Good afternoon, ladies and gentlemen. All protocols observed. We are sorry. I know we started a little bit late compared to what we had planned, the time we had planned starting. But this was due to unavoidable circumstances. But I don't take it for granted that you endeavored to be patient with us. My name is called Abao Chris Paul, and I'm the team leader, Harm Reduction and Reproductive Health Initiative, which is a KP-led or a youth-led organization that basically works with young people. Our major focus and the reason why we work with young people is that we know young people are more vulnerable. Not that they are vulnerable because young people are supposed to be vulnerable, but because our communities have nurtured us in the way that most of the time opportunities don't find us, also at the same time hard for us to find the opportunities. One of the reasons why we are having this engagement is that we believe if we create effective and meaningful platforms for young people to come and engage with the service providers, engage with our own leaders, engage with ourselves, our peers, engage with our elders, we can do something tangible at the end of the day. One of the biggest issues or factors that has led young people keep vulnerable is that most of the time our voices are not heard. Your voices are not heard. So today, as Harm Reduction and Reproductive Health Initiative, we decided to say that we bring the health team of Mbarara City, the head of health in Mbarara City. Come and meet them. Because as we are going to be seeing throughout our dialogue, I know they are going to be showing us how we stand as Mbarara City. The results are so scary. Young people, we are taking lead in HIV. We are taking lead in unwanted pregnancies. We are taking lead in STIs. We are taking lead in so many. Where is the problem? I believe the health team here is going to be assuring us the services are there. Where are we not going for these services? Good enough today, we have a representation from all the sectors, public facilities and private facilities. We want to know where is the problem? Why are we not going for these services? Or why the services are not friendly for us? Is it that we don't see them to be friendly or appropriate to our needs? Does the services really provide that safe environment where you feel free to walk in the facility and go for a service? Or it is they provide the space where you feel like I don't belong there? For example, testing for an STI. How many of us find it possible and okay to move to a service provider who looks like your mother and you want to tell them how you have gonorrhea, how you're seeing pus coming out of your penis, how you're having A, B, C, D, E, F, G? How many of us feel free to move to a facility and go and talk to the service provider? How can I ensure that I don't get HIV, I don't get an unwanted pregnancy, I don't get STIs, or if I have them, what do I need to do? So today we want to take this opportunity, we want to take the advantage of this platform and ensure that we ask those questions that you have always held back, those questions that you even don't feel free to share in even platforms like these ones. That's why we're taking even different steps to ensure that each and everyone will have the opportunity to ask the question. That question that has always triggered you. That question that has always triggered your mind to think, is this how it's supposed to be or not? The other day I had one of the students who was asking me that, don't you think I'm damaging myself? I was like, damaging yourself how? I elect every day when I wake up, every time I see a woman with those features, the features that you will like, that move us. And I was like, which feature moves you? He talked about the nyash. I was like, every time I see every channel, actually, he was like, every channel with the nyash. The other guy down there starts peeping and like, hey. And it has happened over time. Am I safe that every time I erect, I don't have sex? Or I'm not safe? Those are some of the questions. And the problem is that as young people, if we don't get the answers, we tend to make answers ourselves. Are we together? So this is the time we want to take the advantage and ask the service providers, am I safe if I'm in such a situation? Or I'm not safe? Then at the end of the day, we want to see, can we provide these platforms and ensure that young people are in position to make informed choices? The choice you make, we are not here to tell you what to do. We are here to give you information so that you can have a number of options. The day you decide to make a step, you know what you're doing. You know the outcomes. You know the consequences. And you are at the same time in position to handle them. Are we together? So once again, I really want to welcome you, and I really want to thank the team of Mbara City. Thank you for always honoring our invitations. We work closely with the Mbara City, especially the Office of the City Health Officer. We work closely with the leadership of Mbara City, the youth leader. With your team, we thank you for honoring our invitation. It gives us a great pleasure to have different stakeholders, especially in the line of those who are in position to make decisions on our behalf, so that this time, once they are involved in such engagements, they can be positioned to make the decisions that involve our ideas at the end of the day. I also want to thank the schools, different schools, institutions we have around, Global High School, YMCA, International Window School. Which one have I left behind? Which one have I left behind? Is there anyone I've left behind? International Window School, Global High School, YMCA. Which other school do we have around? Mbara Community Institute. Those are my neighbors. Actually, those are my neighbors. And I'm sorry that I forgot, but it's just because I felt I was already home. And also our partners, Reproductive Health Uganda, the in-charge Reproductive Health Uganda, Mastops International and Mastops Uganda. Those are two confuse us, but I think we have both representation here. And I also want to thank Innovation Village team for supporting us in here and there, especially providing this space for us. And also want to thank my team. My team, Harm Reduction, where are you? You can wave a little bit. That is the team that we work with, and more who are not here. We are located in Lugazi, after Mbara East Center, or Reproductive Health Uganda. Then as you're proceeding to Heritage, we are next to Heritage. Along the road there, you'll be seeing a big poster with this logo on it. We provide a number of services, especially for young people like us, and all our services are free. They range from information on HIV, STIs, family planning, cervical cancer, anything around the sexual reproductive health. We provide that information. And at the same time, we are in a position to also refer you to where you can get the right service that is appropriate for you. At the same time, there are services that we offer at our own drop-in center, which is a small safe space. We provide free HIV self-testing self-testing kits for HIV. We also provide family planning services, especially for those that can be offered at a health center one, offered by the VHT. That is injection, pills, those ones we can offer. And STIs, on every Friday we have a full package of all services, testing for HIV, cervical cancer screening, medical male circumcision, testing treatment for all the infections in relation to STIs and STDs, HIV prevention services. We give drugs for prevention for those who are sexually active, and at any time you're at risk of getting HIV. There is a drug called PrEP, which I request that the team later, they will let us know what it really means. We provide that drug, which prevents you from acquiring HIV if you are sexually active. And we also support those who find it hard to go to the facility and get the drug. If you know that walking to a facility to pick a drug, you feel shy, you shy away, or you feel stigmatized in any way, you just come to us and we ensure that you get to the facility or you get your service you need. And remember, all our services are free. Thank you so much. With those many words, let me wish you fruitful liberation throughout the engagement. But let's keep it more participatory and involving. Thank you so much.
Thank you. Participatory and involving. He calls for that. Thank you very much. Who could help us now that he has, talked to us, tell us what exactly we are doing here this afternoon. Okay. Thank you very much for your contribution. But from what he says, we are gathered here this afternoon to achieve a number of things. I could remember around 3 of them. One is to provide us an opportunity or a platform as young people and, all the demographics that are here to, have an opportunity to discuss sexual health related matters, but also not stop at that, get an opportunity to think collectively and have some way forward, and that we can be able to consider. But also, it is not limited to me, the young man. It is not limited to the people we refer to as adults. It is not limited to them as an organization. What could be our roles, different key roles that we play to make sure this information actually gets to be promoted here and there. But how could we talk about health without actually having someone that, is in charge of health in the city, without, allowing us to, for instance, talk to each other or even discuss the matter within the city? So join me to welcome the city CHO. That is what we refer to in simple terms, the city health officer, to basically open our dialogue, open our activity this afternoon, and that I think is going to go miles. So let's do this time a California way, okay? Once again I go, ladies and gentlemen, join me to welcome the city health officer for Mbarara, and he is or she is here to give us, to open our dialogue tonight. Thank you.
Thank you, MC, and good afternoon, all of you. I am glad to be here, and you have spoken a lot about me. But I just want to have a few minutes, like 5 or less. One is to appreciation of this arrangement. Reduction has been in this for some time. And sexual reproductive health services are actually wanted in this city. You are all aware that we are having issues related to sexual reproductive health, including HIV transmission. And like Chris said earlier, some populations are vulnerable. They stand a chance of being affected by some of these issues. One of the areas, apart from HIV transmission, we are vulnerable to getting involved in commercial sex, for example, gender-based violence issues, rape. Mention any if you can remember or recall. But some of these areas, and why we want to get into this dialogue, is to understand how can we prevent all these things happen. For those who don't know, how can they know they do happen? He has told you that the numbers are overwhelmingly increasing day by day. But do we know where we can get some of these services following any event? For example, if a young girl is raped along the way, where does he run or she run to? Do we know where to go? Do we know the services? Do we know how to do the PEP? All this dialogue is meant to look at these ones, and we must think that when we live here, we all understand some of these things. If you happen to go and wanted to seek for HIV testing services, where would you go? Do we all know? That's the aim of this dialogue. Do we know that there are also some self-test kits or strips? You can even test yourself while at home. I don't know if you can show a hand and see how many know that you can even test yourself at home using simple measures. All this is what we are aiming at, so that we have a full package of sexual reproductive health services at the fingertips, so that anyone can seek for services at any one time when he feels he wants or she wants the services. We have partners here, Marriage Stops. I've seen Marriage Stops here. Reproductive Health Uganda, I've seen it here. Harm reduction is here, but we also have health facilities around us. Some of those services are there. This dialogue is meant to awaken everyone, or make aware of all of you. From here, you can also go and talk to your peers, talk to your friends and colleagues about some of these things you learn from this dialogue. If somebody wanted family planning services, they are also available for all ages. We can also talk about these ones in this dialogue. The test and treat issue I talked about, if you can do yourself a test for HIV, you can also, in this dialogue, we would want everyone to know if there is any question that has been unanswered. In most of the forums, we are here to answer some of them. In my team, Dr. Alex introduced himself as maternal, child health, whatever. He's interested in reproductive health services, both from preparation for getting pregnant until delivery, even up to adulthood. Those questions he will be able to answer. We have the data capture. Harriet can also tell you how many young girls are getting infected with HIV, gender-based cases, gender-based violence cases. All those ones are captured. The team is composed of various issues, the environmental areas. We can all get together when we are informed, and as usually the saying goes, knowledge is power. So this dialogue, we hope it will give us the knowledge, and we shall be empowered to go and be citizens who are free of some of these issues. HIV, AIDS, cancer of the cervix, early pregnancy, all unwanted, all those issues, we should be able to prevent some of those. With those few, I would want us to enter into the dialogue and discuss as prepared. Thank you so much for listening. Let's also listen back to you, because you are the most beneficiaries, and we also want to listen and answer some of your queries. I want to thank you so much. Thank you, Harm Reduction, for organizing this.
Thank you very much. I want one person to help me pick what you picked from the gentleman. My sister, God loves you very, very much. Just one line from his address.
One from his address, I learned how to keep myself with the health, to keep my health from the fingerprints.
Keep my health on her fingerprints. One more, I want a gentleman to help me get one line from the CHO's address. God loves you so much, my brother.
me, I'll tell like to I've not understand well because I'm still thinking about because they have speak many things. Yeah.
Okay, so for that reason, therefore, these two lines here, come and occupy these seats here because we need to be attentive, okay? We need to listen to each and every other word that will be coming out of our panelists this afternoon, and we can't afford missing. Let's occupy. There's some seats there. You don't have to miss out any word just because maybe you're seated behind. We still have around 3 of them. Okay, but that was a call to say, guys, we are not just watching television. We need to follow each and every good word that is going to be said this very afternoon. So I can tell you that we are diving into our dialogue, which definitely is the main reason we came around this afternoon. But slightly before that, recently we saw some news and we were all shocked. What was trending about Mbarara, if you relate it with why we are here today? I want someone who watches news. You're informed. Thank you. Go for it.
Thanks. About the news, we heard about escalating heresy misconduct among the youth, especially literalizing HIV statistics in Mbara. So guys, you take care about HIV. Thanks.
Okay. Thank you very much. He used some very, very hard words in there. But I got what I wanted. The guy talks about statistics, and I want us, before we dive into the direction of our dialogue this afternoon, we dive into that with some informed mind. We need to have some facts. And because of that, we have hosted someone that is very, very important to that very note, the city biostatistician, who is actually here with us. And you'll allow me welcome them here to first help us paint the picture. What is it like in the city? What is it like in Mbarara? Where do we stand? And slightly after that, we will definitely dive into the dialogue after that. So join me to welcome the biostatistician to have some facts laid before we dive into the discussion. The hands. You're welcome. Thank you very much. We need the picture. So as the laptop gets set, you had some information for us about what was trending recently with Mbarara. Please.
According to the news, the trending news were like Mbarara City is among the leading districts in Uganda which are affected with HIV, and most especially the youth. So that's all I had.
Okay. Is that right? We recently saw that, watched that, or read that, yeah? Okay, so now this is the opportunity that we have. I need a lady to tell us what has been trending about Mbarara recently, as we sort the projector. Just one lady. Regarding what we have this afternoon, tell us.
Thank you, sir. What has been trending around Mbarara, it's like the youth, we are on top. When it comes to the youth of Mbarara, we are the most trending youth who have HIV. So thank you.
Thank you is very lost in that statement. It's okay. It's the moment of truth, and here with us, we get the facts. Thank you.
Thank you, MC. I'm by names of Nakakawa Harriet, and I'm a biostatistician in Mbarara City. Before I present to you the presentation, I want to make some things clear. Yes, the news were over everywhere. You know, we are now Mbarara City, not Mbarara District. We used to be part of Mbarara District, but we are now in Mbarara City. So there is always that confusion of Mbarara City and Mbarara District. But what happened was, it was Mbarara District that was number 2, leading in HIV infections among the youth. But let us not jubilate and relax and acquire for ourselves the virus. Mbarara City, we were number 24. Out of 100 and how many districts? You see, still we are not doing well. So we need to fight hard. We can abstain since we are still young. If we fail, there are other services being provided to prevent us from getting the virus. So now I realize time has already gone. I need to go straight to the presentation. Here, these are the objectives of this presentation. Number 1 is to inform and sensitize the youth, the young women and men and adolescent girls and boys about the existence of reproductive health services in Mbarara City health facilities. All facilities we have in Mbarara City, we are blessed, we have many. You just have to walk a few meters from one facility to reach another facility. So please, don't let your lives be endangered when the services are available. Then the second objective is to know and understand the reproductive health status among young women, and I think there we forgot boys, but you also exist, and adolescent girls in Mbarara City. And then the third one is to know the HIV status among the youth, women and men, adolescent girls and boys in Mbarara City. Those are our objectives for this presentation. Here we are looking at deliveries among women and adults, young women and adolescent girls in Mbarara City in the year 2023. Here we are looking from January 2023 to December. So we normally have quarters. We have 4 quarters in a full year. We have Jan, March, then June, July, September, October, December. So those are the deliveries we have from girls of age 15 to 19. Those are the numbers per quarter, meaning the whole year we add up the totals. You see that I see some faces already asking themselves why. That is the age of 15 to 19. Then 20 to 24, they are also there. And then total deliveries among young women and adolescent girls, those are the numbers. Here we are looking at the percentages of the deliveries we received in Jan, March. And then you can see the figures in all the quarters. And then deliveries among 20 to 24, we have those numbers, around 29, 30 there, as you can see. Then here we are looking at the pregnancy rates among young women and adolescent girls in Mbarara City. Here we have totals. Now this total, the first figure, is for all mothers attending ANC1. Because every mother attending ANC has to go through ANC1. So here we are looking at the age of 15 to 19. We have those numbers, meaning 9% of the women attending ANC1 was in that age bracket, 15 to 19. And then 20 to 24, we had 33%, meaning the other balance is for the women that are 25 and above. Then family planning uptake among young women and adolescent girls. You know, I started by speaking about abstinence. So if it fails, please run for methods. Tukwe. But that would be abstinence. In any case, it fails because of unknown reasons. There are health facilities providing family planning methods. So we have less than 15 years, we had in girls take up family planning in Jan, March, for June, September 11, October, December. Then family planning 15 to 19, we also have those numbers as you can see. Then the total family planning uptake among that bracket, So we are seeing the percentage of less than 15, we have 0.2, 0.001%, 0.1, as you can see. And then 15 to 19, we have 6, 7, and 8. And then above 20 to 20, we also have those percentages. Now here we come to HIV new infections among adolescent children and young women and men in Mbarara City. Actually, I intended to put for you the new positives and the ones that are starting treatment. So when you look in the first row, we have those who turned positive, 10 to 14. You can see the numbers. Jan, March, we had 3. But look at those who started treatment, only 1. Meaning the youth are turning positive, but they are not. Goals. And secondly, once you start treatment and you take away your drugs, you do not spread that disease to others. Our colleagues, those who happen to turn HIV positive, let them start treatment. Because people have taken treatment for a long time and they have lived to realize their dreams. Then next is we are looking at the young men and women and adolescent children receiving HIV care in Mbarara City. So those are the numbers. But when you start from the left, coming to the right, we are getting new positives. The numbers in care are doing what? Reducing instead of increasing. Meaning, people are starting treatment, the youth are starting treatment, but not continuing, which is also dangerous to their lives. So as we go back home or to our communities, in our schools, let us sensitize our fellow youth. The moment you have turned positive, you just have to accept it and take drugs. By taking drugs, you will live a healthier life and you'll be able to achieve your dreams and also reduce on the spread of the infections. That's all I had. Thank you for listening.
Thank you. Thank you very much. We've been in the dark and finally the light comes. So we now know. We finally know. So every other person can definitely tell that we are time-bound. That is why we are going to really a little bit move chap-chap. The other appeal is, please, we gave you some papers. Now, in case you feel you won't be able to ask your question, one-on-one, you could be able to write it, and we are going to be able to read those questions when that time comes. Though we would prefer you actually grab the mic and talk to us one-on-one, and we can be able to roll. So, ladies and gentlemen, it's that time that we could now dive into the dialogue, which definitely is one of those big reasons that we are here this afternoon. And we have some of our panelists this afternoon that we believe will be the think tanks that we can be able to dig out some facts from, or have our answers. Join me to welcome the Assistant CHO, and I would say this one particularly is in charge of environment, and like we already said, there is a connection that we want to dig out, and it should definitely come out clearly from our discussion. Please, we could have the Assistant CHO join the panel, please.
Okay.
Thank you very much. We are forgetting. Let's do that once again. Next on the panel, we will have the in charge, maternal child health. Thank you. You're welcome. Please, let's get them coming. Next on the panel, we are glad that we have the manager for Reproductive Health Uganda. Please, let's join the panel. Next on the panel is going to be the program officer at Harm Reduction and Reproductive Health Initiative. Please come through and let's join in. Bridget there. Next on the panel, we will be able to have the information minister. Here we're going to have two of them. One from Window. We have someone, the information minister. Please. Okay. Thank you very much. Please come through. We will also have the city youth chairperson, Mbarara City. Please come through. City youth chairperson, Mbarara City, please. Okay, don't worry. We can have more chairs. Okay. Thank you very much. And because God loved you so much, the lady added another chair, and that chair will go to another opportunity being taken by Information Minister. It's the same Atwizuka Arthur Jones? Great. Okay, so I was joking. This other chair is actually going to be mine. Thank you. Thank you very much. A very good afternoon once again. Ladies and gentlemen, this is the moment of truth, the moment we've all been waiting for. It's an opportunity for us to dive into a discussion, but remember, what we are looking out for is actually the role of adults, policy makers, religious and community leaders, young people and service providers in promoting youth-friendly sexual reproductive health and rights services. So we are definitely only looking out for key roles that all these different groups play. I will give one minute each one of us here to welcome the participants, introduce yourself, further. We need to get to hear your names and also the capacities under which you serve, and then we can dive into our discussion this afternoon. As we do this, please prepare all your questions because that is actually the gist of this discussion. Thank you.
Once again, good afternoon to all of the students here from any institutions around global, international window. Sorry, I didn't get you, and the guys in blue. Actually, I'm Atwizuka Arthur Jones. I've told you in the beginning. Actually, I don't have much to say here, but we shall be communicating.
Okay.
Good afternoon, everyone. Good afternoon, everyone. Mwasibaje. Ni mahari yo banywanyi banje batakucenga rujungu narisho no basa kushanga ndo bateganisa makantu konka tuba kwenda gambo ryoko no fama mije konka turije twena. Okay, my name is Bridget Nsimenta and I'm in charge of programs at Reproduction and Reproductive Health Initiative. You're welcome.
Hello. Evening. Yeah, my name is Jubilee Zakaria Golden, and I'm a medical clinical officer. I'm also a public health officer. Yeah, I know some of you are wondering about my age. I'm older. Yeah, and I've been interacting with young people for quite a long time. I've been in the medical field for about 11 years, since 2013, and I've been working with young people. I manage Reproductive Health Uganda, Mbarara branch, and we are located in Lugazi. We also have a youth center, and the most important thing I will tell you is we have a youth, we offer youth-friendly services. This means all of us here, I see most of us are below 25. At least we are 10 to 24 years of age. If you come to our facility, you will definitely have a free service if it is a sexual and reproductive health service. I can't wait to interact with you and have some questions or concerns from you answered, and also to learn from you. Thank you so much.
Thank you. Thank you very much. We need to keep it brief and straight to the point.
Yes, good afternoon once again. Dr. Introduced myself. I work with Mbarara City, and under the Mbarara City Health Office, I'm in charge of maternal, child, youth, adolescents, young people, all those under my surely it is about making sure that your health as young people and women well taken care of. I can't wait to hear the questions and the deliberations these young people have. Thank you.
Thank you. Thank you very much.
Thank you very much. Once again, I'm called Mutibwa Lydia. I deputize the city health officer on issues related to the environment. One will wonder how does the environment contribute to the numbers my colleague presented. We have so many external environmental factors that contribute to the numbers the biostatistician presented. You know, you're very much aware. We have our lifestyles, we have the slay queens, we have the slay kings in all our localities or schools, and we assume it's trendy, but it is letting us down, the slay queens and slay kings within our schools that are taking us to the numbers that were highlighted a little bit earlier. And then we also have issues that I believe will come out in our discussion. The issue of drug abuse among the youth is also on the rise. We need to appreciate and learn how to avoid issues related to drug abuse. We have external factors we need to appreciate that I believe will come out boldly in our discussion. Let us feel free and ask all what is on our hearts for us to appreciate and address the issues we have within our schools and institutions. Thank you very much.
Thank you. Thank you very much.
Thank you. My name is Ainembawas Johnson. I'm a fresh graduate in biomedical engineering. You may congratulate me.
Congratulations. Congs.
Well, you cannot talk about youth, you cannot talk about sexual reproductive health and rights, and you don't talk about youth. And so you can't leave out youth leaders in their communities. Because we represent the youth at different political levels. And that is why I'm here. All my counselor, I hope we can have open-minded discussions. Thank you.
Thank you. Thank you very much. Ladies and gentlemen, that's the panel that we have in the house this afternoon. And we cannot wait to get into the discussion. We will be able to start straight with, well, the microphone liked you very much. Let's start with us clearing the table. When we mention environment, someone asks where it actually, connects with sexual health, reproductive related issues. You could first help, draw that picture. Once we understand that, perhaps that will guide some questions from our participants in the audience. Thank you very much.
Yes, thank you very much. One would wonder how environment comes in, but we have external factors that surround us as youth that predispose us to sexual challenges. And like I had earlier highlighted, the environments we live in, the schools we live in, expose us to issues that take us to encounter challenges related to reproductive health. I talked about the issue of lifestyle. In our school communities, you'll all agree with me, we tend to envy the beautiful girls, the handsome boys who keep on slaying around the schools. And these are the same beautiful girls and handsome boys in the holidays that get exposed to you can see the issue of intergenerational sexual triangles that occur. During the holidays, the slay kings and queens interact with the
the people that are predisposed to HIV/AIDS. So there are the same slave queens and kings that come to our environments within the school communities, and then they also still mingle with the same communities, and you're there, you're saying, okay, so and so, patience is so beautiful, how I wish I could get in touch. And then when you get a chance, then you get predisposed to HIV/AIDS. And then we've realized, I don't have the numbers, we've realized the issue of drug abuse among the youth. And over time and again, drug abuse is an external factor. And as youth, you're doing it in a hidden manner. You go behind the dormitories, you find a clique of girls and boys exporting in schools. I never had it in our times, where people take, I hear daddies, people have sweets, but when they are drugged, and then they sneak them into schools, and all these are external factors. And once someone is exposed to drug abuse, then their minds are distorted and they can be predisposed to any issues related to HIV/AIDS. There are other predisposing factors, especially if you youth get into the holidays, even when it is not a slave king or queen, but because of the desire of having a luxurious life, you will tend to give in to any demands from the bigger men. So we caution you, young children, young youth, please, you have all the time ahead of you. Don't tewe gomba. Tewe gomba, don't say, if I don't have this, this shoe, if I don't have this sneaker, I can't do away with it. You can't die without that beautiful sneaker you're admiring. So that bit of us feeling that we need to achieve this has taken us miles and taken us dangerous routes, leading us and predisposing us to HIV issues. Thank you.
Thank you. Thank you very much. Loud and clear. And the question of environment is actually answered. It's who you are with or what is around you that is definitely going to be influencing some of these decisions. Let's move to maternal child health. In charge. We are very glad to have you around. You are handling, I think, partly some of these numbers that were read to us. And Mbarara City having, our young ladies, 1,198 of them between the ages of 15 to 19, getting to deliver, they're pregnant and the rest. I understand there are those that definitely are not reported even or something like that. But this only tells us that your office is definitely crucial in this very space. So what could be your role as, the in-charge maternal child health in this whole thing? We are talking about your role as a stakeholder in addressing sexual health, reproductive and rights, reproductive health and rights issues of young people. Thank you.
Much. I think it is fine. Thank you very much, our moderator. I think, let me first these numbers. And we want to thank our biostatistician. Just three things. One, the numbers presented are telling us that young girls, you can get pregnant. Is that clear? I know some of you think you cannot. You can. Okay? That is a fact. The second fact is that some of you here and those who are out there, you are already sexually active, and actually you've already started practicing sex. That is also a fact what these numbers are telling us. These are numbers. You cannot get pregnant unless you're what? you get engaged in sex, unless maybe if your mother Mary, the one we are told about in the Bible. Tokubasa kujirenda wotaterini. Now, the other fact, you saw that slide about the contraceptive use. Of course, there are some controversies. Why shangangwiwe maybe tochoma ubundi urebero kuzire watandika kuba involved. Hariho imihanda yo kubasa kozesa obutagirenda. But the unfortunate bit is that most of you are not using those services. Okay? Because you saw the numbers are very small. Very small. And then the last is that actually some of the girls who get involved in these sexual activities early, you saw those last two slides. They are at a risk of getting HIV. There were over 300 plus every quarter, every 3 months. Every month, actually, over 100 girls are testing HIV positive. Okay? And by the moderator, these are the people only who come to the health facilities. Now, I know this is all about girls. Boys, ababishaba. Tumwa barangusirimu bajine. Kanda nabo jona butumwa abareba. So iwo tabareba aha ukara abantu babonire mbatambura mbagira sirime gizreta ekiruho. Okay? Now back to your question, what role? Actually, moderator, the biggest challenge we are having, these people when they get challenges, bakwenda kwisho marwaro. Ijeno inche. Abikibingi mbabare pinjirokwe. Nuzoko jirobu zibu, ujirendwara, ukwisho marwairo you don't want. So tuija hakubagambera, nkabe byamagara, that actually amarwairo getu giyugwiri. For your own information, gona marwairo abashaho abarimu, they have been trained on how to offer use-friendly services. For sure, if you come to our health centers, because you're young. Even if you get pregnant, it happens. Because if you to look at statistics of girls who are dying aborting, yeta marwairo gariho babasa kwakira tukureberere turebe ngo wajirota wazaraje cyo cyabaho then to counseling turengo wanu cyenda kushoma wagaruko mu ishomero ningo washome kindi related to HIV amarwairo getungahereza obuhereza bwebikwatirine na HIV. Okay? Okuchebera no kwabusha buli rwairo jone jol kureja government utandikira okaza refaro kaza municipal okaza nagandi ruti ngahi tuna marwairo mingi okuchebera tuba kwiyo sente. So abincho takugenda okachebizo kamanyo ko yemerire. Okay? Kana waziyomba kwegese bindi. Now chabaho okabi involved in sexual matters. No muntu obundo wota kumanya okwayemerire. Tukabentu bashaba nko kuba statistician yagamba at your age abstinence is the best. Torafe by the way. Ujize ngo taterine nofa. You can't die. I can assure you, you will not die. Konka chaba. Ogundo mahando gundo kwenda kumanyisa abantu moderator twine mbaze kubasa kuyamba na waterana n'umuntu inakakoka sirimu eje mbaze kakwera katakwate. Are you aware of that? Marahuliro mbazo kubali kweta PEP. Post exposure prophylaxis. Ogwo mbaze ntugukuhereza within 72 hours ogumera sirimu te kukwata. Kandi ogwo mbaze no gwa free kwiya osente. So mukoze sobo bohereza. Imahanda ya family planning amarwairo getu gijwira abashobali trained ubwo bohereza buliyo mu bukozese. But above all tukabentu bashaba nk'abana bato because all of us were once like you. Ningati mukuchimanya nabo bashaha bakuru muri kureba aha n'empangare nabo bakaba bari nk'imwe tukarabayo tumanye biriyo try and fight that stage. It's very important. Waje messing up future yawe nawe wajita. So moderator, that is how but for us we want to listen from them. Yes. If an opportunity arises. But tugambire, what challenges do they face? Bija nkoma rwairo gitu ninga tuongere muki ninga tubakorere ki kurangwa buhereza bwabahika.
Okay.
Thank you.
Thank you very much. We will definitely get there. I am my manager from Reproductive Health Uganda, Mr. Gordon. Okay. You're definitely equally into handling a number of cases related to what we are focusing on this afternoon. The question would be, though, where could you have found the gap? Where is the gap? But also, you could slightly echo your role again in case there could be some services, for instance, that you're able to offer that are different from our previous speaker. And then I know most of them will be coming from the questions. But as of now, the biggest question is, where is the gap?
Thank you so much, moderator. The biggest gap is on lack of information. Ladies and gentlemen, we are in the information age. And we have a challenge of misinformation. We have a challenge of information overload. You don't know what is right and what is wrong. We are in an era where everyone is a journalist, in that when, say, an accident happens, everyone is fighting to be the first to post. And this is the biggest problem we have in the sexual reproductive health triangle. People think when you use family planning, you'll get cancer. Young people think when you use condoms, ngwagamizi, that lubricant in the condom causes cancer. So there's a lot of misinformation. There are lots of myths and misconception. And also the other challenge, I will re-echo what my colleague said. Young people, especially the males, do not want to come to health facilities. Omuntu naarinda amara kushasha yaira chekufa. For instance, yafuna nka STI. Nabanza yaire mwa kushesha. Abona kuija. And yet, at that point, you could have got more complications. The women, they will come, like, say they got an STI. They will come when they have lower abdominal pain. They will come when they get backache. They will come when they see body bankamizi mabiga kuruga hansi. That is when they want to come. So these are some of the challenges we have. And these challenge yetuine no kugira ngu for us NGOs to in a challenge with funding currently. The funders have reduced. The funding has reduced. Tukatsibo mu community ntero rwide ntremesa abantu ha sexual reproductive health okwiha mwenda family planning na nebindi konkati when the funding reduced most of us are just seated at our facilities and waiting for people to come. Also kare noza kwichizana yungaka haro young talk haro straight talk. Yes. These are the things that groomed us when we were growing up. Konkati ebye bintu tibyachiro. So these guys, they get guidance from their peers who may also not have the right information, and they end up messing up.
Okay. Thank you very much. In the interest of time, definitely, I know he seemed to have some more information, but we can be able to roll. He notes some negative healthcare attitudes that we often carry, but also lack of adequate and accurate information regarding this. Now, the next batch of our panelists, you fall in the category of young people, like young. Our manager told us that we don't forget him when we were talking about that. But let's start with you, Minister of Information at International Window School. You have very many cultures, joined together. You have a number of people here coming in and out. In your opinion, what do you think we are not doing right?
Thank you so much, moderator, for this time. Actually, as we all know, we spend most of our times in schools. And it's not that every school attends such education. And when we are home, before we come back to school, most of the times our parents work. So when the parents leave, students get, or the youth get chance to do whatever they want because the parents are not there to guide them. So that's one of the reasons why it happens. And the other thing, when we come to schools, schools we meet different people from different places. And these people, they have different lifestyles. As they were saying, one of us said, we'll come to school and start admiring Okwegomba. And when you go to school, you want to be like that guy who is always smart. And these girls will always go for that boy.
And is that true? Wow. Okay.
Actually, the other thing comes in. You know, we find people of different body shapes. As they said, nyash. That nyash calls for a lot of things. So, and when we're at school, some uniforms are tight. So when they put on those tight skirts, tight dresses, they call for the attention from the boys.
Tell us more. No. That's on a lighter note, but yes. You could summarize, please. Yes.
Okay. Most of the things we do are caused by different categories of people that we have at school. The only thing we should do is to focus. As students, as the young youth, we should focus on what took us to school, because this is where we spend most of our time.
Okay. Yeah. Thank you very much. I needed to hear those hand claps that are coming through. It's very, very straight to the point. If you go to Twitter and search Nyash, you will be entertained by what content is coming through. Bridget, you are into this space for whatever that you're doing, and you're representing an organization that looks at harm reduction and definitely the reproductive health with whatever that you have within your objectives. Let's answer the same question, Bridget. What aren't we doing right?
Thank you so much, the moderator. First and foremost, we have to first look at the youth-friendly services. What aren't we doing? But what are we exactly supposed to do? What are the youth-friendly services? We are talking about services that are friendly to the youth. We are talking about services that are accessible, that are appropriate, that are effective, services that are affordable, you know. When we talk about the youth-friendly services, maybe someone here might not be knowing what exactly am I supposed to get. Something that should be driven, but self-driven, you know, demand-driven. I am a girl. I am beautiful. Today I want to meet Joan. What exactly am I supposed to do before I meet Joan? I know that I'm going to get pregnant. Oh yeah, I need a baby. But which class are you in before you crave for the baby? Those are the services now that you have to first know. What exactly am I looking for? Okay, if at all I wanted to have sex. Because I know we do have sex, don't we? I know we do. Yes. So the data is reporting that we are having sex. So do I know that I'm supposed to get a condom before having sex? Have I tested the man that I am going to sleep with? Do I know his status? And am I ready to take care of the child in case the man has run away? Maybe Bridget is not too cute for me. in my family, we only marry big girls with big nyash, and she doesn't have a big nyash. So you have to think about very many things. Are you ready to be a single mother? So we come here to give you the services before something happens. We are doing this at a primary stage.
Okay.
We provide the service. Before you go there, we say use a condom. If you cannot abstain, use a condom. And if you do not want to use a condom, be ready for the consequences, okay? So what aren't we doing? What we are not doing is knowing what exactly we are supposed to do. But if you get it right, you're good to go. We are safe.
We know what we're supposed to be doing, but we are not doing the right thing. Let's hear from the chairperson, youth chairperson for the city. Papa, your city is at stake when you go to NBS, if you visit their timeline. These reports that have been coming through, though, of course, today we had some, at least relieved. We are resting now. But even then, we're told we are number 24 in the country. Though, I thought we are number 1, number 2 there. But your city is at stake. What aren't we doing right? Please.
Thank you. Once again, I'm Johnson Ainembabazi, the youth chairperson from Mbarara City. The manager, Reproductive Health Uganda, talked about one thing. Before, growing up in my primary school, we had PSC. Have you heard of PSC? Straight talk, just like he has talked about. Do you still have them? Do you? I actually thought I am not seeing them because I'm no longer in high school or primary. So this brings me to the point, to the question, what are we not doing right?
Yes.
Unlike before, where there were a lot of strategies to curb these issues of sexual reproductive health, these days things are a bit different. Youth are more exposed than actually the previous times. I actually first saw a condom when I was, I think, in P7. But these days, a kid in P4, P2 has already been exposed to that. What does it show you? That youth of these days are more exposed to such things, and that is where the problem is. So, what is our call now? We are aware we are exposed. What do we have to do? What are we not supposed to do? Don't we all love our lives? Of course we do. When you see the SDGs, Sustainable Development Goals, there is element number 3, which talks about health and well-being. You cannot achieve that when you're not healthy. And that is why we need to protect our lives. Social media is exposing us a lot and making us vulnerable to such things. People are now watching pornography at a young age. And we forget that these are actually not our things. Madam talked about abstinence. You can abstain and you don't die. So we shouldn't take our lives for granted just because we've seen maybe this one expose nudes, this one do this and that. Just because you've passed by that memory place and you saw people almost naked, we have a lot to achieve. When you look around, you realize that most of you are students. And do you know why? You're the most vulnerable people. People will find it easy to distract you because they know, hey, you've only seen an iPhone on TV or a good phone or a smartphone, and he will give you that phone. How much is it? 500, 300, 200. You can even get a smartphone at 140 or even on loan. And can you imagine you can get HIV just because of an M-Copalo phone that has been attained on loan?
Mm-hmm.
So, guys, this is not something to play around with. This is your life. Just like me, all I can say, not the red top thing, but guys, and we take conscious of our lives.
Thank you.
Thank you.
Thank you very much, Twebedemu. Please take care of your life. Now, this one here is a moment that we've been waiting for once again. It's that time that we could be able to ask some questions direct to the panelists. But remember, we also have these tables besides us, yeah? So in case of any questions still that would want to go to any of those stakeholders, we still have them in the building, and I'm sure we will be able to have them come through. So I'll be able to pass the microphone. Thank you. Thank you very much. The microphone is up for grabs. Please, you have all the time to ask any good question that you want these people to actually answer. Please. Let's go first.
Mr. Moderator?
Yes.
There are papers we have also shared within. If you feel that you are not comfortable holding a mic, just write your question.
Thank you. I observe the protocol. Good afternoon once again. Oscar Nwamanya is my name, and I'm the chairperson, School Council International Indoor School. Before I continue, I would like to ask, how far with this medicine of HIV, the total medicine, not the ARVs, the medicine that cures HIV completely? So when I go back to the theme of today, we know all babies are born by mothers. So I've seen in the statistics, Mbarara City is at 24, is in the 24th position, whereas Mbarara as a district is second. And I've seen the madam who was presenting it was like, okay, for Mbarara City we are a bit lucky. But we can't be lucky when our mother is suffering. We know Mbarara to be a city came from a district. So what are we going to do to these people in the district? Because it looks like they are suffering more than us who are in the city.
Okay.
Like.
Thank you. Chairperson, the question is right understood, not so?
Okay,
yeah, sure.
Thank you.
In the interest of time, let's go straight to the question, and so that we have some good time to hear out some of these answers. Please go.
Thank you very much, sir. Yes, I first appreciate you for the information given to us.
So we have some group that are following us live. If you don't mind, you
Thank you very much, our moderator. I first thank you very much for the information delivered to us. This question goes to you. As you said that we have to abstain or sometimes we use preventive measures. I would like to know, at least you highlight us about the preventive measures that we're supposed to use as we safeguard our life. Thank you.
Thank you. Thank you very much. Question is right. And please, it would be good if you also mention if there's a particular entity or person that that question should go to. Okay, please.
Thank you, sir. Me, depending on the statistical analysis, there was that incident where we have old people versus young girls. So, we are emphasizing more about the youth, but the old men, they are distorting our girls. So, girls, girls, I'm advising you, take care if you see there is a body demand, you look for your ages.
Okay, thank you.
Then the question about HIV, you know, this body demand also is a problem to us, but I wish to ask, for how long do I get to know that I'm HIV positive? Because for us, we are so scared about shivering when we are going for medication. So then another thing is all about that I have had PEP. That PEP, for how long do I take PEP so that I become safe? Thank you, sir.
Thank you. Thank you very much. It was loud and clear. Old guys, please. Okay, we could have, we could hear out more now from the female side. Priority, please, yes.
I observe the protocol. You all talked that, I heard the madam saying that in case you don't control yourself, before you go there, you first test. There is a counselor, I remember, who came at our school, and he said that those sure test oral quicks that they use, that when you get to a person who is used of taking his medication clear, that even when you test him, you cannot get him positive. What do you want us to use? Thank you so much.
Omuntu agoyingewa. Okay, let's, we need to hear out some more questions from ladies, please. Ladies, grab the microphone. Grab the microphone, and we want to hear from you. Okay.
Hey everyone. The question is going to that Madam had talked about the environment changes. For us, we girls, there are some times whereby you receive your MPs, but after some time you stop receiving them, whereby you can even finish 4 years without receiving them. And whenever they come, you don't get the real color that you have to get when you're in MPs. You find out when the colors have changed, and sometimes you also feel pain, like there are cramps and yet there are not. So, what is the real cause to that problem? Is it the environment change, or it's the cancer of the cervix or the HIV? And what is the problem that has led to that? That has led to that change in your body.
Thank you. Loud and clear. Loud and clear. A month ends, you tell your friend, and the friend says, "Go with it." Okay. Yeah. Okay. Please.
Thank you. Here, this question goes to the madam. Some people tend to have their medical checkups, and of which I'll come to the clinic or maybe whichever dispensary where I get that medicine from that nurse. Like, let's say I'm wanting the medicine, let's say over there which pills they use, and the real doctor, the real nurse will give me the tabs. I go, I take them without any information about it. So what can we do on that point? And another question is, some of us people, we do get information from maybe elder people, and they're like, go use this medicine and it will work like this and this. So you should also advise those people on how they should be directing these young men and girls on how to be using the medicine. Some people do have wrong information about the medicine they give us. Thank you.
Thank you. Loud and clear. Loud and clear. We could have 2 more questions or 3. Please.
Thank you. I have two questions. One goes to my beloved madam, saying like you were talking about the slay queens and the slay queens and the slay kings are the one like giving diseases to we young ones, and the school and the learners, the students. I don't think that are the only ones. Yeah, I don't think. So, and I have the second one. It's like we girls, things which make us to have early pregnancy is like we have this thought, like when we go on the internet and you request for safe days, what, we have this thought, they tell us 14 days after periods are for your safe days. And you try those safe days, you go there, unwantedly, you find when you are pregnant. You get? So I don't know whether safe days are there. I don't know. So those are my questions. Thank you.
Thank you. Thank you very much. Safe days. And before you know it, you're saying, Jesu. We have a lady that was asking some question. Oh, okay.
Thank you. I heard from you, sir, that there is HIV test which I can use even though I'm at my place. I would like to know whether if I go to the health center, am I allowed to receive that HIV test? Oh, bravo.
Come again. You got it? Okay. Thank you. Okay. Let's have the young man, and then later we have a lady there.
Protocol observed. My question goes, State office, why are some condoms sold and others are for free?
Mm-hmm.
And another question is like this. Heard of injection that they give you to reduce on the effectiveness of HIV virus. Is it true or it's false?
Thank you. Loud and clear there. Let's have one last question there. Mm-hmm.
Hi guys, I think mine goes to some parents. I know we have some parents in the building. If not some parents in the building, at least we have future parents of the nation. This goes to the parents. Your daughter is out of the house or your son is out of the house, dressed, you've not committed. Okay, even if your son or daughter is dressed in a way that won't please the environment, you're not commenting about it, and later, the environment will get back to that child. I think that should be from the parents. If you've not told me what should be done, how do you think I'll know what should be done?
Thank you.
Because in my right senses, I feel like, wow, I'm smart. But that's not what the public is seeing.
Thank you very much. And that's a good way to end the one-on-one questions from the audience. You already asked to, but it's okay. The microphone. That could save a day, please.
Thank you. This goes to us. When should one go for medical checkups? In case I may see the signs and then I'm not sure of which disease am I suffering from. You've talked of infections, what, like that. When should I go for medical checkups? Thank you.
Okay. Thank you very much. When should I go for medical checkups? Oh my. Let's give this gentleman. You might find.
Okay. I would like to all the speakers of today. Is my name. So, sir, the question is about the economy. So some condoms either they cause cancer because of their frauds. At which type of condoms are we supposed to use, or other ways to live?
Mutuweyo recommendation. Which type of condoms work better than the rest? Okay. Thank you very much. Those were some amazing insights coming from you, ladies and gentlemen. In interest of time, I've been told it's coming to 5:30 already, and we want to conclude by 6 p.m. So, dear panelists and our guests, allow me, I'm sure most of us really noted the questions. We'll read what was written also here. You could still note some of these. Now, when the time for answering comes, each one of us won't have many minutes, certainly 3 minutes. But if you hear so-and-so has answered a certain question, you might not have to repeat it. You could go for the next ones. Let's start with... So thank you very much. Let's dive into the messages that you sent through. Welcome, and thank you very much for listening in live, yeah? Telling us more, tell us more about family planning, because some people tell us that family planning is actually very, very dangerous, okay? If you find that you have infections, are you not able to produce? The other one was a request. She says to always come to schools to give advice to all students. The other question is, if you find that you don't afford any of the family planning methods and you're not ready to give birth, what should one do there? Those things are expensive. Atenga, I can't really control them. So, the other questions, can it be possible to sleep with someone with, who is HIV positive and you don't actually get it? They always, okay? They always talk of infections that are common in girls. Are they sexually transmitted, and what are their signs? I think you meant the symptoms and the likes. Then also they talk about contraceptive pills. How can they be harmful to the uterus and one's health anyway? Okay. The other question is, okay, assume that you got pregnant and you want to abort. What are the problems that we can get when at a young age? How can we avoid temptations among young boys and girls? Temptations. About the HIV injection, this wasn't a question. PEP and drug abuse, this wasn't maybe you could have someone elaborate about the HIV injection. One here. We have another one here. Why women and girls are many with HIV positive more than men and boys, according to some statistics. She says women or girls are many compared to men. Why is that so? How can someone test him or herself to know if he or she is positive or negative? That's another question. The other one is, I'd like to have a contact. I don't know. Did you want my contact? I'll be very glad to share that. Effects of medicine that control or prevent HIV before 72 hours. I think he or she wants someone to echo that. Okay? In the interest of time, what will happen when you practice masturbation for very, very many times? Yeah, because, it's one way to abstain. My question is about if someone finds that he or she is sick, what he or she, okay, I think, yeah, he or she wanted to know what will one do if they found out that they are actually positive. How can you test HIV when you're home or if you feel shy to go for treatment? Then number 2 says the best way how you can prevent HIV/AIDS apart from abstaining from sex. Echongo chijeko, abstain aside. What could be the best option? Make sure you actually stay safe. How can I test myself while I'm at home? What is the best method for family planning? And the third question is, does birth control pills, okay, I think the question was, are birth control pills good to use or not? What are the dangers that come with that? Again, a question about birth control pills. Lastly, I want to know the problems of family planning. Do we feel that these represent what we wanted to ask these people, or we have another burning question that we have aside? Okay. I wanted us to answer these once and for all in the interest of time. So there are 2 more questions. Some service providers at facilities judge us when we go for family planning services. Those guys can judge. The other question is, when you go to a health center for STI treatment, they only test you and send you outside to buy drugs. Yet some of us have no money. Tukolechi. We have one more question, I'm told, in the background. We have some more questions. Yeah, please, let him grab an opportunity. We want the panelists and the experts in the building to actually answer all these questions, and then we can be able to call it an evening. Please.
Thank you so much for this opportunity. My question is like this. We have been hearing about signs of HIV. Elaborate more about those signs. Tell us those signs that are for HIV.
Signs of HIV. If I laugh a lot, am I positive? There's someone else? Oh my. Let's do chap. Okay. Please let's receive one more. In interest of time, again, dear panelists, like I said, each one of us has around 3 minutes to be able to answer some of these questions. But before that, I wanted to give an opportunity to, there are questions that were directed to the CHO direct, so he could be able to respond to that. And then later we can come back to the panel. The other question is, what are the best measures of family planning to the young girls? I think we need one particular session around family planning. The other question was, what is cervical cancer? How is cervical cancer treated? Can HPV cause cervical cancer? Please, warning signs and symptoms of cervical cancer, causes of cervical cancer, prevention of cervical cancer. What is HPV? This one here was talking about cervical cancer in capital letters. Are there chances of anyone getting HIV when having sex with a person who is positive and that person takes his medication very, very well? Could there be some chances? Okay, let's give the microphone to the CHO to quickly answer those few questions that were directed to him, and we will come back to the panel shortly.
Thank you, moderator. And I want to thank you guys for this engagement and for this round of questions. I am going to try to summarize what I have captured. If I miss, the panelists will do what? Will do. But one of the where I am going to start from, these engagements are meant to ensure that we don't get these infections, whether HIV, whether cancer of the cervix. I wouldn't want to hear questions saying, how do you get HIV? I would want to know, all to think that you all know. How do you get? I would want to know that we have known how to prevent. We are here to do the prevention strategy of all the diseases, all the infections through the sexual reproductive organ of a human being. So I will start by this one who said, what are the chances of having HIV with a person who's positive and taking ARV religiously? That one, the chance is there. We have talked about preventive strategies. We have talked about abstinence. We have talked about if you fail abstain, use a condom. We have said if you use a condom, maybe you get an accident during the act, use the PEP. If you know the person is having HIV and on treatment and you fail to control all those ones, also you can use PrEP. PrEP is when you use the drugs before you even go into the sexual activity. All of those are interventions for prevention. But there is nothing like a chance of surviving. There is always a chance of getting HIV once you get in touch with the virus. Let me talk about cancer of the cervix. HPV is called human papilloma virus. And it's the virus which every man has and can transmit it to a girl. The only chance is the girl when you have the virus and you stay for some time, you can fight the virus and it goes. But if you fail to fight the virus, or you have it several times, you are likely to have cancer of the cervix. Still, I go to the prevention strategies. We have talked about vaccination, HPV vaccination for girls less than 10, all in P6. Is it P6? Around there. That is the first prevention strategy. If you fail to get the vaccination, always use the condom. If you fail to use a condom, go for screening for cancer of the cervix regularly. And these are the areas that we are talking about. Facilities are screening. Drop-in centers, when you go there, they will assist you to screen. I believe that harm reduction also does the service. And RHU and all the facilities. We are also bringing services, many services, for screening for cancer of the cervix. So for women, I encourage you to always go for testing or screening for the cervix. Like I've said, I didn't want to hear somebody say, what are the signs of HIV? Would you want to have it? I wouldn't want somebody to have HIV. Just prevent, forget about the signs. But if you want them, just enter into the drop-in centers. They will explain much more than that. But the signs, I am sure, they always change and they move from one person to another. We cannot have similar signs and symptoms. If you test positive for HIV, what next? Do you know what to do? Visit a health facility. Just move into the drop-in centers of these guys, RHU, harm reduction, marriage stops. They will help you into that area once you test positive. I am trying to rush. Somebody talked about masturbation. That's a psychological disease. You must go and see a psychologist. If you have that as a problem, just understand it's a problem, it's a psychological disease. You must attend to a psychologist because it's not a normal activity. PEP, I have talked about PEP. PEP is when you have been exposed, either by accident or you just found out that you have been exposed, you just go within 72 hours. You visit any center, like I've said, drop in for the facility, they will provide you for this PEP. And it's available for free of charge.
Dear CHO, I think we could be able to conclude.
I'm almost done because all the questions, I think I am tackling them. Parental guidance, it's the role of parents, surely, to impart moral values to our children. But like you said, it's an observation, but every one of us has a responsibility and a role to play in order to impart morals and values into our young girls. Condoms, about self-testing kits, they are available. Drop-in centers, health facilities, free of charge, they will teach you how to use them. If you want us to bring them to schools, because some schools don't also, but they are available. One of the issues that we are here is to let you understand that those services are available and you can access them. I think the others, I can give the other chances. People the chance to do what? I think if there is anything else I will add. The environmental factors, somebody was talking. Girls put on tight dresses, what? Those are the factors that can lead you into shit. So you should also learn how to put and dress appropriately. But when you put the nyash thing, the tight dress, and you meet a boy and you make him feel bad, something else can happen. Also the drug users, especially boys and men, the drugs are also factors that can lead you into trouble. Okay. Those ones, I think, the other panelists can add. Thank you.
Yes, thank you. Thank you very much. Dear CHO, some hand claps for the gentleman there. Thank you, thank you. So we come back to the panel. Each panelist has only around 3 minutes to go for some of these questions, as you noted, but also some of those that were not answered by the CHO. Maybe some that stood out, we need something around family planning. I think PEP also kept coming through. There was also something around test kits, how safe they are, and the rest. Someone says sometimes MPs zibula, and your fellows are saying kawe de muda. Could there be some scientific proof that I am still safe, or what could be some of those causes, and then the likes. Self-medication, she put it clearly. Someone needs to tackle that. Then there are a few policy questions. Condoms being free, and some others are sold. Then, for instance, CHO here says we can be able to supply some of these self-testing kits or paper and whatever. What could be the side of the policy? Masturbation. CHO, the gentleman, seemed to say we are abstaining, but while we are abstaining, masturbation is here. So what could be the, long-term effect of masturbation? So the panelists could bring that out clearly. Are we safe or not? Parents' role, kudos to the lady that brought us up to the speed. That is something we needed to include here. The role that parents can be able to play is very key. And then lastly, when should one go for checkup and the likes? Of course, we're sure most of these questions were actually noted by the panelists. 3 minutes, you answer those that you feel you can be able to answer. If you can't, you say pass, and you have the microphone go to the next panelist. Yes.
Thank you so much.
I'm going to answer one. When should we go for medical checkups? Actually, if you know you do it, it is advisable for you to go for a checkup every after 3 months. Every after 3 months, you go for a checkup as you do it. Okay, the thing is, if you know you have sex, you go for sex. Go for checkups every after 3 months. In case you play sex in those 3 months, go for a checkup.
Okay.
Thank you so much.
We are yet to confirm whether that is the scientific kind of recommendation that you might want to have. Yes, thank you very much.
Okay. So I will answer 2 questions. One was about dealing with sexual orientation. I am attracted to my friend. I'm attracted to the other gender. How can I deal with that? Should I stop getting those attractions and feelings? Let me see someone who doesn't have feelings here.
I also want to see you.
I've never fallen in love. Let me see. Anyway, it's normal to have the feelings. It's normal to be in love with someone. But my dear, do not fall in love with her problems. Do not fall in love with her sicknesses. Do not fall in love with the other bitter part of her story, which entails disease, okay? So as you get attracted, keep it at the back of your mind. This person, is she safe? That is why I emphasized testing this person before you engage in the sexual intercourse. Then another one was about the social stigma and having fear to access medication. The CHO talked about it. Harm reduction is a drop-in center, and it is a safe space for the youth. Even though you just come and you're like, Bridget, sure, please, help me. Yeah? I don't want to get HIV. I can be of help, okay? So feel at peace, feel at home. There are very many sources where you can go for services. Do not have any fear. Just drop it. I can as well go to Dr. Jubilee at RH, like, Dr. Nimpurani Shashokoku. Yeah? And he's like, what happened? And he will give me medication. So be bold, stand for your health. Thank you.
Thank you, Bridget.
Yeah, thank you so much. The questions are so many. We shall try to be as brief as possible. I want to add something small on cervical cancer. Someone was asking, can it be treated? The earlier you test, the better. We all know that cancer has stages. If it is still in an early stage, there is treatment, and this treatment is actually available at Reproductive Health Uganda. We use a technology called thermocoagulation. That is what we do. Then there are a lot of questions about family planning and condoms. People want to know if those two cause cancer. There is none that causes cancer. Family planning is safe. It is known worldwide by the World Health Organization as safe. Same applies to condoms. And someone is also asking, why are some condoms sold and others are given free of charge? CHO, there is a tendency of people thinking that condoms that are given free of charge are not good enough, they are not safe. Those condoms are very safe. We give them free of charge simply because they are a donation, okay? Then I also want to answer a quick question on long-term effects of masturbation. This is self-stimulation to achieve sexual satisfaction. Now, people think it is very safe. After all, I've not engaged with someone else. But it is very bad. Why? One, it is very, very addictive. Simply because you can do it with yourself and get satisfied. Some people do it until they get wounds all over, and they keep doing it over and over again. There are students who run out of class to simply go and masturbate. 2 minutes, he's done. He comes back feeling okay. And this is very, very dangerous. It will disturb your mind. Like the CHO said, it is a psychological disease. You need counseling, and you need to stay away from it. It also affects your quality of sperms. Guys, we don't want you to, we don't want a time to reach when you want to have a child and you cannot, simply because you were addicted to masturbation. I'll answer one more question and then give my next colleague. This is about getting wrong information on medicine. Also, someone talked about misinformation on safe days. Those safe days in Bevarevia. Then someone also talked about misinformation on family planning, that it causes cancer. Now, guys, this is what I said in the opening remarks, that there is information overload. Information is everywhere. We don't know which information is right, which information is wrong. Everyone updates uploads information on every website, and as long as you check Google, you think, since this is from Google, it is right. No. Go to the right people and seek the right information. Thank you so much.
Thank you very much, and thank you very much for these very brilliant questions. How I wish we had a lot of time. We would answer one question to go, but let's try to make an attempt. Colleagues have already answered most of them. Cure of HIV, as of today, there is no confirmed cure of HIV. Whatever you're hearing, whatever you're reading on internet, it is not true. Are we together? There are a lot of research that is being done into that area, but unfortunately none has been confirmed by World Health Organization to be cure for HIV. What we are very sure of is that if you have HIV and you take your medication, the ARVs, you can live long enough like any other person who doesn't have HIV. That is very clear, okay? Testing negative for someone who is on medication and is HIV positive, that is true. And actually that is why the CHO was telling you to be very careful. Lately, people who are HIV positive and are taking their medication, when you test them, there is a high likelihood that they will turn negative. The test will show that it is negative, okay? Yet this person is HIV positive simply because this person has been on medication for long and the virus has been reduced so low in the body, and so are the antibodies, and this person, you may not get it, okay? That is why you need to be very careful. For us, when we are growing up, they used to tell us that actually every person you see, just imagine this person has HIV, okay? That is not to say that you shouldn't test. The good news is that actually that person who is taking medication very well, the chances of him or her transmitting HIV, they're also very low. Actually, there is what we call U equals U, okay? Undetected equals untransmittable. If someone is taking medication very, very, very well, this person may actually not transmit HIV, okay? I think that answers a number of questions. But you have to be careful because the moment this person stops taking the medication very well, the virus will come up, okay? And imagine if you test 1 month, and maybe after 2 months, this person is not taking medication very well, and you're having sex regularly. At that moment, the virus is very high because he's not taking medicine, and you've not tested, you're still relying on the other test or the other results. This person can actually transmit HIV to you. That needs to be very clear. So take note of that. Someone asked about painful periods and periods coming and going. That happens when you're still very young, okay? Recently, the age of menarche seems to be going down. Menarche is the first period you get as a girl. And this age differs. It's not like every girl must get it at this age. I have a daughter who at 9 years, just recently, she started her periods. 9 years, okay? And I know some of you can share your experiences. Some of you 10, 12, 14, 15. Some it can even go up to 18, 19 plus, okay? Now, periods can start and stop when you're still young. They start when they are irregular, okay? They can't be, most times they are not really consistent at the start. Can start, you jump 3 months, go in, after take some time. Some actually they can start and be consistent. That happens and you don't need to be scared, okay? It happens, it's normal. Eventually they stabilize and become regular. And the environment, my colleague, also has a very, very big impact on how your periods are going to behave. You've been at home, you've changed now, you are at school, okay? Maybe there's some stress, maybe change of diet. All of this can actually impact on your hormones, which hormones control your period. There's a lot of science around periods. Unfortunately, we don't have a lot of time. And so is the pain, and some ladies will get pain, others will not, okay? But the pain you get should be bearable, okay? Shouldn't be too much. Simple cramps, but if it is too much, that is where we say, please go to the hospital. Let's make sure you have a checkup, and we be sure that there's nothing wrong beyond the periods. The issue of safe days, I'm happy a colleague has talked about it. Young people, be very careful. May I want to tell you, at your age, there's no day that is safe. Our bodies are not like robots. These ladies will tell you, your cycle changes every now and then, doesn't it? This month you take 28 days, another month you take 30, another month you jump even a month, okay? But also importantly, you may even be consistent, but you find for you take 30 days, another one takes 28, another one takes 20, another. Now, if you take the rule of day 1 to 14, but for your period, the cycle is 30 days, you're going to get it wrong. At your age, my simple advice is, among the things you're going to think about for contraception, don't think about safe days. Please. And if you're 2, let it be at that age when you're going to get married. You sit with a family planning consult specialist, someone who has studied, assesses you, how long is your cycle, when does it change, doesn't it change, and then he will guide you very well on which days you can conceive easily and those that you may not. But at this age, I would say let's forget about safe days. They are going actually to cause you problems. Let's stick to what my brother has said. These other methods are there. They are proven. There's no method that is being given that is harmful. Otherwise, the Ministry of Health, World Health Organization, they would not have approved them. They may have some minor side effects, but at least they are proven to a very big extent to be safe. Condoms can work very well. Pills, they are there. Injections, they are there. Implants are there. IUDs, they are there. All these are different methods. And these methods, they can only be given to you by a qualified health practitioner. You will get lost.
Okay,
There are still very many questions, but I don't think we can.
We only have 4 minutes to 6 p.m., which should be our stoppage time. But thank you very much. You've been very, very much elaborate on most of these questions. Yeah, let's hear out from you.
Yes, thank you very much. I would like to thank my other panelists for answering most of the questions. Most of them have been answered, but I just have one comment. As the city health team, the questions that have been raised signal and informs the city health team that we need to step up and strategize on how to support the youth within the city. And then we also would like to thank the organization and request all other organizations to come on board and support our youth in the city. One question that was raised was, how do we avoid temptation? One of the common strategy that schools have put in place are the extracurricular activities that we have in schools. Can we engage in some of these activities? The more we engage in petty discussions at school, it leads us to temptation. And can we engage in the extracurricular activities that are within our schools? And then also, someone raised an issue that some of our health workers judge the youth. As CHT, we have a fora. These are some of the issues that we raise to our partners and then also to our health in charges within the city. Most of the issues or questions have been raised, have been answered. Thank you.
Thank you. Thank you very much.
Thank you. Being the last speaker, most questions, of course, have been answered. I will only do the advocacy role on like 1 or 2 points because I'm a youth leader. Now, this is a call to the health enforcement team. When you try to visit these hotels or guest houses, you realize that in every guest house, when you enter inside in the, let's say, the bathroom, you find soaps, the rest. But when you need a condom, you will go to the reception. Does anyone notice that? And my friend is saying he doesn't go there. But this is it. Hotels and guest houses are like the playgrounds for such cases, especially with the young girls, because these old men invite them over in such places. So the health enforcement team, there is need to caution the hotel management. Then also, there is also a problem in schools. The advocacy is lacking, and a lot. So please, if there are any efforts you can put in place, our city can be free from HIV. Thank you.
Thank you. Thank you very much. A round of applause to the panelists here. Did you say you wanted some 30 seconds? We are definitely time bad, but grab the microphone. I wouldn't want to be the bad one here.
Yeah, sorry. Just about menstruation. Someone is really concerned about the color of the blood and also the pain that comes with it. Of course, during menstruation, most girls or women will get pain. Why? Because your uterus is contracting and relaxing to push out that blood. So you don't need to worry. If the pain is too much, then you can seek medical attention. For the color, blood is never strictly light red. Even the reds are different. If you have a lot of iron, then your blood might be almost black or too dark. So you don't need to worry about the color of the blood. Thank you.
Okay, thank you. Thank you very much. CHO had promised, in case something is left out, he would come back, and here he comes.
This is just some important communication I wanted to make outside of this dialogue.
Okay.
And I beg you to take it serious. For those ones who have heard of yellow fever, which is a disease, the ministry has planned an activity of vaccinating everyone from the age of 12 months to 60 years. The campaign will run between 2nd to 7th of April 2024. I am here just to advocate and request you to inform everyone in this age group. During that time, we shall visit schools, we shall visit communities, and we shall ensure everyone gets a dose of yellow fever. Because it has been spreading throughout the country. We have been vaccinating the northern region and western, northwestern and eastern. But the disease is now coming down. So I want you to embrace this activity and make sure everyone is vaccinated. Let no one be left behind.
Okay, thank you. Thank you very much, dear CHO. At this moment, I want to thank very much people that have been following us live on YouTube. We've been live on the YouTube page, the YouTube channel of HRRHI, and Sunny, you've been one of them. Kifene Dennis, you've been one of them. Arimpa Marvin, Ariamanya Arnold, Krish Isa, Kali Swizi UG, Pamela Nahurira, Kamsime Julia Caesar, Mark Godwill Turiabe, DK Ibrahim, and the rest of us that have been following us live on YouTube. We can't thank you enough. Now, we have something that we could end with. We have some teachers in the building. I am a teacher. Two of them. We have Eno Easy there. Eno, joking. So teachers have some gift of analyzing some, a lot of information, and finally give you some conclusion, and you finally have something to take home. So you'll allow me receive a teacher from International Window School. You have 1 minute. Please say whatever you want to say about the dialogue.
Yes,
Okay,
good evening.
Please. Thank you.
My name's Kasangachi Elvis from International Window School. I'm glad we are here today to be part of this arrangement, and I would like to thank the organizers and the health community, plus the panel. Thank you very much. I want to take a few seconds to analyze, to give out the points of my analysis. Basically, we didn't talk about some issues. Circumcision wasn't talked about, yet boys need it in schools. We should also talk about more of the awareness. For example, in my school, I act as a senior woman and a senior man at the same time.
Hi.
I always get, yes.
Hi, madam.
No. I always get questions from the girls because I'm the only free administrator with the students. You find a senior woman is so strict that, a woman and woman thing, they always fear each other and hate each other. So you find a girl coming to me asking me, why are my periods taking longer? And I'm forced to go to the internet to inquire. So how sure am I that the information I'm giving back is the right one? You understand? Then also, we haven't talked about the health. When you talk about health, we only focus on the girls. The boys also need this awareness. It's a lot. I can't go into detail right now. But I'm facing a challenge. Please, I want to blame the health ministry. Sorry to use this language. Yes, you pick taxes from us, but you don't send your people to come and educate the students. We are not educated in that line of in that sector of line. It's not my job. It's the ministry supposed to make sure at least train a senior woman and ensure that every school has a trained senior woman to be able to talk to the girls, to talk to the boys. Otherwise, thank you so much. God bless you.
Thank you very much, dear Madam Teacher. No, I'm joking. That's on a lighter note. So, ladies and gentlemen, we also have an opportunity to host the principal from the principal Barara Community Institute with us here.
you will allow me welcome him equally to have something to say about the session. Please, you're welcome. Thank you very much.
Thank you, our MC. I first thank the facilitators for giving us this wonderful information. Ladies and gentlemen, you have heard a lot has been said here, but you are in charge of your life. If you think that somebody is going to drive you and he takes you where he wants to take you, then you are done. I first thank our MC for having not recognized me during the time of introduction. And I thank you because this one is majorly for teenagers. I'm above 50, but below 60 years. When I tell you that you should not indulge in these activities, please don't think that they are kidding. I want to tell you that I was at 31 years, and even my parents doubted me that I'm not functioning. Because I grew up with my my grandfather, who lived for 106 years. He just slept and he died like that. After giving us stories, how was he taken up by the people who were buying Africans, and how he escaped from them. You know those people? People whom they were taking for slavery. So the man told us that you younger people, don't tamper with somebody's daughter, because I don't have cows, I don't have money. If you mess and you pregnant that lady, you get sickness, then you will suffer it alone. From there and then, I protected my organ after 31 years. So when I got married, there was a common disease called the kisununu. It was the only disease that was, they call it kisununu enziku. But now we have got a variety of enzikus. So protect yourself, you people. Protect yourself, and you live to see a lot of things. One of the facilitators talked about temptation. Why do you want to be tempted? You want money when you have not reached the stage of getting money. You are here preparing yourself. Tomorrow you are going to become presidents, ministers, and you have money in your pockets. But one of the facilitators mentioned something that amused me, that a poor man, particularly like a border, he will go and gets a smartphone on your own, then he takes my daughter. Then at the end of the day, my daughter is a victim of AIDS. Really. If you are a person who studied nursery, primary, secondary, how many years are those? Really, you give in to a border and you achieve AIDS because you want a smartphone? If you have your dad, tell your dad that you want a smartphone. And always, our facilitators, this younger generation we are having, they have the tendency of hiding information from the parents, and it is simple to them to tell an outsider. Which outsider will end up not giving clear information, clear guidance to you younger people. And you will end up pushing you into problems because he wants to see you suffering. So for that matter, I want to give you the last word, that you should be the driver of yourself. And you should drive correctly until the horizon. Thank you very much.
Thank you. Thank you very much. And yeah, thank you for thanking the moderator. Trust me, it was by design. Like you can see, you're giving a keynote address at the end of the session, and that was designed by that. But we are very, very glad to have you and the team from Barra Community Institute. We have you should have some vibe. If you're in here and you're from, Barra Community Institute, you need to have some vibe. Okay? Okay. Do we have some? Okay, so it's fine. Ladies and gentlemen, it's been very, very important that we all got here this afternoon, and you see us closing to the evening. We will be able to end it on a good note. If you can have some strokes here, please prepare to take us through. Even if you don't, we are going to pick at random. No, I'm not. I'm joking. If you can, please prepare to entertain us. But as we close this, ladies and gentlemen, what could be our call to action? What could be our way forward, or what do we do next? Now, that question, I only want to be answered by the gentleman that opened us up. Please, let's give it up for Comrade Chris to tell us, a call to action. At the end of the day, we talked, but then what? Thank you. Please. Thank you, sir.
Thank you, Sangala, our moderator. Thank you, everyone, for the active participation. Our panel, thank you for the information you shared with us. Our CHO and your team, we are always grateful. The leaders we have around, our youth leader, Mbarara City. The good thing is that you were around. You saw how we are standing as Mbarara City. And here we are your people. And you saw where we are standing. And I know throughout the whole dialogue, you had the views from the young people, what we want, where we are standing, and the issues that make us stand where we are. Our partners, Reproductive Health Uganda, Maristops Uganda, we are grateful for being with us throughout, because you're one of our key service providers for sexual reproductive health within our city, and we are grateful that you're always with us. My call for action, they are basically basing on a number of issues, but there is one that has really stood out, and I believe that CHO and your team, we really have an information gap. Not only to young people themselves, but even the people we live with, at home, at school, in the communities, people we interact with, even our leaders themselves. We really have the issue of information gap. And I think the call from one of the teachers was very clear. How can we improve access to information? We really need, I know the city has a health educator. We have different partners within the city. Mr. CHO, we really want you to engage us. When we were requesting the schools to provide us with students, one of the other things we are doing together with Bridget, our program officer, is that we are requesting the schools to invite us to come and do health education talk. And the truth of the matter is, as one of the panelists said, resources have reduced. We no longer have this money to say you go everywhere and do whatever you want to do. We were supposed to have this dialogue for the whole day, come in the morning and finish in the evening. But even ourselves, the resources are limited. We couldn't afford to have people here in the morning, give them break tea, give them lunch, and all that stuff. So how can we use the available resources, the little they are, and the little avenues we have, and we do something tangible? So I want to call upon the school heads who are here. Use us. We have so many partners within the city that provide this information, especially information around sexual reproductive health, including HIV.
use us. Call us when you have assemblies, call us when you have other avenues where we can come in. And for us, we are going to take the initiative to ensure that we contact the office of the CHO and we have someone to come with. The CHO and the team, I really want to take this pleasure to say that we are so grateful as harm reduction and other partners. It's one office that you call upon anytime. Whether you have money or not, they will be with you. So we are grateful for that, and we need to take the advantage of that and ensure that call on us. RHU, the in charge here, you call him, he will never hesitate, even if you don't pay him. After all, he's your neighbor up there. Malstops, the in charge is not around, Madame Liz, but we have a representative from Malstops. Malstops is one other center that you call upon, they will be there. So the issue of information, access to information, we won't wait for the city to develop IC materials and other programs to work on this, but we can use the available opportunities. We are there. The schools, you have leadership. When you invite us and you say that you come and give 3 days a week, 1 hour per day, and you train our school leadership in issues around HIV, sexual reproductive health, we shall train them, and by the end of one term, they will be in position to become peer educators and pick up the role of giving information to their fellow students. And we can do that for free. We can do that for free. The office of the CHO can provide someone to come and do that. Because as a city, we really need to take our own step. So I really want us together with the office of the city health officer and the school leadership, those schools who don't have their teachers to get here with us, but we know you have your school leaders, students leaders, please let's take up the initiative and make sure we make a step on that. As harm reduction, together with my team, starting with next week, we are going to make a roundup within the whole schools. And we see those that are ready, and we develop a work plan for that. And we shall ensure that we share with the office of the CHO. Then we see if we can always have someone together with us visit these schools. Then the other call for action, I drive it from a number of sharings that have been made, together with the sharing our principal said. The truth of the matter is that we are our own drivers. One of the reasons we brought you here, we never brought you here to tell you what to do. We brought you here to give you the avenue where you can get the information. But the decision, the choice is, it's mine, it's yours. Are we together? So the thing is that we are providing you with number of options so that by the time you make a decision, you know that you have made a decision out of an informed mind. Are we together? Especially girls. The reason why we are saying, Mr. Teacher, the reason why we are saying that focusing more on young girls and adolescent girls and young women is that it's not that we are forgetting a man, because we know that a man and a boy are the lead in most of the issues that are happening. However, a lady is so vulnerable. So vulnerable. The relationships you are in, we are the ones who decide when we are going to have sex. We are the ones who decide whether I should use a condom or not. We are the ones who decide whether I should test or not. The other time a lady came at our DIC, and when I asked her, when did you last test with your boyfriend? She was like, I talked to my boyfriend about testing. He told me that he only tests in November, and he does thorough testing in November. Ati mshi yakwemera kakuja ngwena testing November yonka. Ameza testing. Of course, at the end of the day, Nana hiding a bit. But the fact that this one is a girl, she didn't initiate a relationship. She has no powers in the relationship. She always say yes, because at the end of the day, at times I even to be vulnerable. But here we are saying that let's stand as young people, whichever sex you are. As long as we have access to information, let's make decisions that really favor us as us, not anyone else. He said that when they were growing up, they were being told everyone has HIV. If you turn, and the issue is saying that the in-charge MCH was telling us that even some people test and show that they are negative when they are positive. So what does to ensuring that we are living a better life. Then the last call for action is the truth of the matter. When you see the results they showed us there, those results were being captured from people who made a step and went to service point. Do you know what that one means? It means services are there, but we are not going for them. Let's take a step and walk into a health facility. We have so many health facilities in our own Mbarara city here that offer free services. Services all for free. Whether testing for STIs and all that stuff, whether treatment, all for free. But we are providing MMC Health Center for in a setup here. So or in a choices you can move wherever you want. Let's make that step and adapt health-seeking behaviors. Walk to the facility. The good thing, what I wanted to say, maybe what we didn't talk about, is that every facility in Mbarara has an adolescent peer, has a peer for young people. Every facility in Mbarara, right, Mr. CHO? Has a peer for adolescents. When you get there, there is someone who is going to talk to you. All facilities we have here in Mbarara, at least I know that through some of the partners, including RHU and others, I know they have trained the service providers in youth-friendly service provision. I know we always get those changes where we get new service providers. They are being brought on board in Pola. Let's move there. There is someone who is going to welcome you and ensure that you get the service. The Basawas are no longer the other Basawas we used to talk about. The following day, they are no longer those ones. Let's walk there. They are no longer the other Basawas where you walk and come in because you are 15 years, you want family planning and they chase you away. School heads, the truth of the matter, whether we want to or not, young people, as she said, we are having sex. Everyone knows sex is good. Sex, we all know. But the way you do it, if you don't do it in a safe way, then it becomes another issue. Isn't it? So these services are there at the facility. Walk there. If you are not ready to become pregnant, for you, akantu no kakunda. Kahi, mwakamanya kali. Go for a preventive measure. And I want to thank most of the institutions that are near us. We have big number of you guys coming to our DRC to receive these services, and we're so grateful. Come to the facility and get these services. So that is the last call for action I was giving. And to say is that, again, we are located in Lugazi. Warga Reproductive Health Uganda, Warga Youth Center Ninga, Orkuza Manji, Ninga Shorkuza Heritage. Along the road, I'm handing out Honza Kulibaicha Pachango, Chandicho Harm Reduction and Reproductive Health Initiative. Come inside and get the service you want. Come inside and get the referral you want. Go to the facilities, including RHU, Malstops of Herezo. Malstops, I believe you have a toll-free line where people can call and ask questions about SRH. I would request you to have 1 minute and read for us that number. RH, do you have a number they can call on? And as they prepare their numbers, in case you have any question, you want a service, you can call on this number. It is 0200 0200. Abashomi baredi mbachira kugira ngo note 0200 91 2494. 0200 91 2494. Then our WhatsApp, it is 0775 20 17
33. 0 775 20 17 33. And on WhatsApp, you can even send us a text and say, call me, I have a question on SRH, and we call you. That airtime is available. Then RHU. RHU, this is a toll free for RHU. You can call if you want to ask any question about SRH. 0800 299 003. Noti munana noti ibiri mwenda noti ishatu. John RHU. Then the one for mass stops, it is 0. Remember your RHA number it is toll free, so which means no Wakotini center you can call, isn't it? Then your mass stops, it is 0759 004 037. Noti mushanju mwendo, noti ina noti ishatu mushanju. Kandi simeze chino chazo tuziro terms and conditions applied. Nicho chino chazo. Call anytime you want and ask the question you want, isn't it? And I assure you that all these numbers I've shared with you, you can get the information you'll be requesting for. Kandi nda kubashaka kujangu kugendo misho, we shall always engage you in a number of interventions. You always come up and ensure that we provide those platforms where the voice of a young person can be heard. Thank you so much.
Thank you. Thank you very much. Some round of applause to the gentleman. Okay. So we are definitely done. What follows next will be a group photo. We are going to have that from outside at the entrance. I'm called Sankara Biarhanga. I am the community manager in Innovation Village, which is the place that we are at today. But I'm also a team leader at Creative Campus. And specifically why we are in here is we are working on a mobile application that targets university students and I believe institutional students, those who have access to mobile phones. I had questions of us who are shy, how can we get some of these mobile app that we are working on called Backup, and Backup seeks to work with these health support ecosystem players to make sure that I can be able to order for some of these things unanimously. I don't have to kind of walk in at any point, but I can be able to have some of this delivered to me. Of course, there are quite a lot of terms and conditions that are applied. But also at Creative Campus, we have Creative Digital Media, which has made it possible for us to go live on YouTube, Facebook, and these other activities. So in case you have those events, definitely they could be able to come through, and we are glad for that. Institutions available, harm reduction and reproductive health initiative, kudos to you. Marriage Stops, kudos to you. Reproductive Health Uganda, thank you very much. We don't take that for granted. City Health Office, thank you very much for, coming through. Now the rest, please, when I read, you say, yes, the loudest you can be able to get to. International Window School. Okay. Mbarara Community Institute. Muja, I can see. YMCA. Yes. Global High School. No. Let's go again. Global High School. Okay. Do we have some people from the Rebicona community? Yes. No. Some of them didn't come through. But that is to say, all of us who came through, thank you very much. Let's now have a group photo outside here at the entrance. We want to keep some of those memories. Yes, thank you. Thank you very much for coming through yet again.